Just have a seat there. Good afternoon. I'm Nurse Eldridge. Most of you already know me. I'm your nurse here at the Kemper-Neshoba facility. I'm here today to educate you on some important things that you need to know about antibiotics. It's time for all of you to get smart about antibiotics. You may think you're sick and you need an antibiotic, but that's not always true. For starters, antibiotics will not cure everything that ails you. An antibiotic is a drug that kills bacteria, and it won't kill any colds or flus no matter how lousy you feel, because those infections are caused by viruses. Antibiotic stewardship. Antibiotic stewardship is defined as the coordinated interventions designed to improve and measure the appropriate use of antibiotic agents by promoting the selection of an optimal antibiotic regimen, including dose, duration, route of the administration of the medicine, cost, and adverse effects. So in layman's terms, I'm going to explain to you today how antibiotics should and should not be used in order to help reduce the incidence of antibiotic-resistant strains of bacteria. We will discuss what antibiotics are. We'll discuss what the use of antibiotics are, the use and misuse of antibiotics. Sorry, I'm trying to get my slideshow to work here for you. There we go. The use and misuse of antibiotics, antibiotic resistance, and then the goals for this education that I'm giving you. What are antibiotics? Antibiotics are powerful medicines, also known as antimicrobial drugs, that can kill bacteria, and they only kill bacteria. Antibiotics do not work against viruses, which are organisms that can cause illnesses such as the common cold and flu. Antibiotics enable physicians to cure bacterial illnesses like some ear infections and strep throat. I'm going to give you a few definitions of some things, and then we'll discuss why you need to be careful with the use of antibiotics. What is antibiotic resistance? That's what I'm teaching you about today. It's the ability of the bacteria to resist the effects of the medicine that we give you, the antibiotic. The antibiotic resistance occurs when bacteria changes in a way that it reduces the effectiveness of drugs. It reduces the effectiveness of chemicals or other agents designed to cure or prevent infections. You take the medicine, if you don't continue and complete your regimen, the bacteria can survive and continue to multiply, which ultimately causes you more harm. What are bacteria? Bacteria are simply small organisms that are too small to be seen without a microscope. They can be found everywhere in the environment, indoors and outdoors. Certain kinds of bacteria can be useful, such as those that are found in your gut. You know, that helps to digest your food, or in your colon, or your intestines. But most bacteria are not helpful, and they're basically germs that can make you sick. Viruses are germs that can cause infections such as a cold or the flu or bronchitis. A virus can travel through the air and enter your body when somebody else maybe coughs or sneezes. Your body will try to fight and kill the virus. Sometimes it'll do it pretty quickly, and if not, your body can't kill the virus right away, then you'll start to feel sick in 1 to 2 days. No medications are needed to cure sickness caused by a virus, especially not antibiotics. Antibiotic resistance happens when bacteria build defenses up which allow them to fight off or become resistant against the antibiotic medicine. Resistant bacteria cause infections that are more difficult to treat. They result in longer and costlier treatments, hospitalizations for people, and they must be treated with stronger antibiotics that may have more serious side effects for you. What can you, as a group, in this facility do to fight to help fight the antibiotic resistance? Number one, don't ever take an antibiotic for colds or flu. Don't ask for antibiotics for colds or flu from your doctor or practitioner or whoever's taking care of you. They won't work, and you will not get better any faster. I know a lot of you don't believe me, and you ask for them anyway. But just because you have a green runny nose doesn't always warrant an antibiotic. If your doctor prescribes an antibiotic, make sure you finish the prescription even if you feel better. Never share your antibiotics, and never take any leftover antibiotics if you don't complete them, which you should never do. You should never have any leftover antibiotics. You all know that, and you know how I preach about finish the 10 days. Don't share them, don't trade them, you take all this because you need this antibiotic because you're sick. You have a bacteria that needs to be eradicated. If you don't take them all, what you're doing is basically making that bacteria more resistant to the medication you're on. So for you and the next person that comes along, it won't be as effective. This is part of how antibiotic-resistant strains of bacteria are made. Antibiotics are needed for bacterial infections such as strep throat, urinary tract infections, staph infections, which we have. Sometimes they may be needed for middle ear infections or severe sinus infections, not just the common sinus, a sinus infection where you've got a little yellow drainage. It's important to talk to your doctor or myself so that you can take the right drug for the right bug that you have. Antibiotics are needed for bacterial infections. They're not needed for viral infections. You don't need antibiotics for cold, a flu, strep throat. For colds or flu, chest colds, or bronchitis, or coughs. You do need them for strep throat, staph, urinary tract infections. Most sore throats are just caused by a virus, and you don't need an antibiotic for that. The misuse of antibiotics occurs because many people believe antibiotics will be better, they will make us better quicker whenever we're sick. The general public and everyone I come in contact with here at the facility often expect or demand antibiotics for every little sniffle that comes along. Studies have shown that patients in the free world will drop a physician if they don't get an antibiotic when they request it. And then doctors are pressured by patients who often write prescriptions for patients that aren't necessary. According to the Centers for Disease Control, 20 to 50%, which is a lot, of antibiotics prescribed over each year are unnecessary. I asked you to write down a few questions for me to address during the presentation, and then I'll take some more questions after we finish taping. One of the questions that was given to me was, I've been taking my antibiotics for a while, now I feel better. Can I stop taking them? Well, I think I've already addressed that, but the answer to that is absolutely not. You have to take the full course. You should take the full course of medication as directed by the doctor. The minimum amount of antibiotic you took, say 3 or 4 days, you feel better, and you stop taking it. It may have killed the susceptible bacteria, but it leaves the hardiest ones to survive and multiply, which makes bacteria resistant to the antibiotic, which results in it not working for you the next time you have a problem or a bacterial infection. The next question was, what can I take if I have the cold or flu? Don't you need antibiotics for that, for the flu? No. The answer is no. Antibiotics do not take care of the flu. They do not treat the flu at all. Do not demand antibiotics for the flu. You do not need them. They will not work, and you will not get better faster. You should get plenty of rest, drink lots of fluid. You can go to the medical department and talk to them about over-the-counter medications that you can take that might help your pain, fever, cough, runny nose, and other symptoms that you're having. These symptoms take time to resolve. I tell y'all this all the time. It takes time. And you only need medications that will help alleviate your symptoms, and so you don't feel so bad during the duration of your flu or a really bad cold. The next question is, what can I do to keep from getting sick? Other people are always coughing and not washing their hands. Well, I can tell you this, and every time that someone comes up with a cold, I tell you this. Proper hand washing is probably the most important thing you can do to prevent yourself from being sick. Washing your hands with soap, including the backs of your hands, between your fingers, for 20 to 30 seconds will help keep you healthy. Maintaining good health through exercise, going outside when they allow you to go out, eating properly, getting plenty of sleep, all these things play into being healthy. In addition, immunizations, which you all hate, they help you to avoid serious preventable diseases such as flu and pneumonia. Every year we offer the flu vaccine for free to everyone in this facility. About a fourth of the population, out of 400 people, usually about 100 will take advantage of the flu shot. It's really important, unless you're allergic to it, you should take the flu shot. Why should all of you care about antibiotic resistance? Well, antibiotic resistance is one of the world's most pressing health public concerns. Antibiotic resistance causes illnesses that were once treated with antibiotics to become dangerous infections because the antibiotics no longer work. Antibiotic-resistant bacteria can spread to family members, co-workers, and threaten your community. Your community, all of you, your community is this prison. So you're all living in close quarters, and if many of you are abusing antibiotics or misusing antibiotics here in your community, if other people are doing it, not specifically you, that's basically threatening your community. You could potentially acquire a bacterial infection from someone else who've been playing with their antibiotics by taking a few when they feel bad, obtaining some not by the doctor, maybe trading them, getting them in a way that they shouldn't be getting them. They'll use them incorrectly. So the strain of bacteria that's in your community, which is your zone of 50 people, or really the whole facility, but really just your zone mainly, it can turn the infection to something that can't be treated, and it can lead to serious disability or even death. Some people think a person becomes resistant to the drugs. Well, that's not how it works. It's the bacteria, not the person, that becomes resistant to the drugs. Once the resistant bacteria is in your community, the medication will not work for anyone who acquires that infection from it. So anyone who is actually misusing the antibiotics in your cells, in your zones, are actually endangering you. So if you're not doing it and they are, it's still going to affect you in the long term if the bacterial infection becomes resistant to these that we use here. Which in turn means that we would have to send you to Rankin County, where no one wants to go, and they have to be used with IV antibiotics, IM injections, different things that we don't offer here because you're supposed to be well here, and we just don't offer a lot of different medications. So, in summary, since the development of new drugs are costly, pharmaceutical companies have done little research in the last decade. The development of bacterial resistance has spurred and revived interest in the development of new antibiotics. Some of the disease-causing bacteria have mutated and developed a resistance to many of the standard antibiotics. This could have grave consequences for all of you, for all of us, everyone, the World Health Community, public health, unless new antibiotics are discovered or improvements are made on the ones that we currently have available. Some of these infections can become deadly. Antimicrobial stewardship interventions have been proven to improve individual patient outcomes, reduce the overall burden of antibiotic resistance, and save healthcare dollars for the healthcare community. If anyone, including healthcare providers, hospital administrators, policymakers, patients, which is you, will work together to employ effective antibiotic stewardship, the programs, we can improve patient care, more effectively combat antibiotic resistance, and ultimately it saves lives. One way all of you can make a difference, every one of you in this room, you can take this information, and I'm going to give you a post-test to take, and you can take it back with you to share. And the information that I have here, I'm going to give it to you to take with you. You can help educate your fellow inmates when you notice that they're misusing antibiotics. When you see someone taking a few antibiotics for a cold, explain to them nicely, how it affects all of you in the facility if an antibiotic-resistant bacteria becomes prevalent. Or you can let me know that I need to post more educational material in your area if you're not comfortable speaking to someone about their antibiotic misuse. The more information all of you are armed with can make a huge difference if you will share and educate your specific communities. And you know what I mean here at this facility. Now, I'll post this information in each zone, and I welcome any questions, and will listen to any concerns that you have. I really appreciate you letting me speak to you and educate you on this information. Something we do every day, but thankfully I got this time to present it to you in a way that hopefully it will help the entire facility. Thanks.